Every other year, a group of Minnesota doctors, nurses, medical professionals, and volunteers travel to the Philippines to provide care to thousands of people in need. The Philippine Minnesotan Medical Association, known as the PMMA, started those mission trips in 2002. This year's trip will include 105 volunteers, including doctors, nurses, and support personnel. Longtime PMMA volunteer Jim Chalmers, who was also born and raised in the Philippines, explains the significance of the work.
With our group, whether you're the top surgeon or the top nurse or helping in administrative positions and so forth, there's a bond that develops. And a lot of those bonds we've seen since it started 8 missions ago, 16 years ago, they're still there and are really, really pretty strong.
After a while, you have a core group of folks who are engaged in the same mission. They have the same vision, they have the same motivation, they work together as a tight group, they get things done. When you have that kind of group of people involved in mission work, you can actually do a lot of good. The vision to do something starts with one person, and then the expression requires that other folks agree, abide by the same spirit, participate in the same work, and go do the work that they are comfortable with and familiar with and would gladly do for free.
This year, in its biggest undertaking to date, PMMA will open a new hospital in Mariveles in the province of Bataan. It's a project that few believed was possible. A long-abandoned building has been rebuilt and will be used as a hospital for the first time by the Minnesota volunteers.
We're basically doing like a soft opening of the facility, and we will be bringing most of the personnel to help operate that. But we're working in conjunction with the local government and the medical and dental community in Bataan, who are also going to be working with us.
Through the partnership with Matter More, much-needed supplies have become available.
We are equipping the whole 66-bed hospital with all the equipment that is needed to run it. So it is basically a building that we're putting all the necessary equipment for that hospital to operate. Also the IT part of the hospital.
Information technology is a new frontier in overseas medical missions. In most cases, records have been kept with pen and paper, but a new relationship between the PMMA and Slingshot will make that a thing of the past. David Nelson of Slingshot explains.
The electronic health record potentially could be used for collaboration prior to the trip, and will also be used during the trip and afterwards. And also they can use it for mining the data to get a little bit more deeper analysis of the procedures they performed and so forth.
This electronic medical record will enable us to document histories, pictures, diagnoses, and plan for the patients that we see. This will enable us to see patients prior to arriving. This will enable us to see those patients after we leave, and also share the information with other medical mission groups that potentially would go to that community. It is a very hard thing to make. It's a very hard thing to put up, expensive, but I think it is something that eventually can be shared with the other medical missions groups, not only here, but I think Africa or any other countries that there are medical missions, yeah. And that's the plan, is to be able to share this. And I think based from our history with Health Partners, we have a couple of volunteers that are IT specialists with the EMR, plus David, who I think we have a good group to really make this quite successful. And that EMR will be part of that hospital that we are going to use in February.